Endometriosis is when the lining of the uterus grows outside the uterus. This medical condition can cause pain, stomach issues, and infertility. It affects about 5 million American women. So we asked Dr. Shar Kavusi, he's a reproductive endocrinologist over at St. David's South Austin Medical Center, to appear on our show to kind of answer more questions. Welcome back, Dr. Shar.
Thank you so much for having me again, Jenny.
Tell us what endometriosis is. What are the symptoms of endometriosis?
So endometriosis affects about 10% of reproductive age women. And it's just like you said, a condition where the endometrial lining, the lining of the uterus where a baby is supposed to grow, grows somehow outside of the uterus within the pelvis of the woman.
So besides pain, how else can we tell if we have it?
So pain is the main symptom in the pelvis, and it can be during different times of the menstrual cycle, during the menstrual flow, at other unpredictable times with intercourse as well. And there's also sometimes some spotting that can be abnormal from time to time that can happen. And there's some really rare cases where it shows up in other parts of the body, really rare, like in the lungs or the brain, where they can get like coughing blood during their menstrual flow and some seizures sometimes during the menstrual flow.
That sounds dangerous. I've never heard of that.
They're really rare. The most common, overwhelmingly common symptomatology is pelvic pain.
Okay.
That's the main thing.
You said it affects 10% of women, but do we have an age group that it mainly affects?
Yeah, so I mean, it's usually like reproductive age women are somewhere around like probably in the early 20s to early 40s, but it's usually going to manifest itself around the early 20s. And women are diagnosed anywhere from 6 to 10 years too late a lot of times, because they're first treated, rightfully so, with pain meds and or hormonal contraception or hormone treatments to mitigate the pain. When it's controlled, it just kind of gets medically managed like that. And when they come off the meds, this flares up again, and it progresses over time. The disease actually is it's very unrelenting. I mean, it really affects women. It affects quality of life, just being able to go to work, being able to go to classes if they're in college or in high school sometimes, even not as commonly, but teens can sometimes be affected. They're not supposed to be hurting like that. So it's very much a red flag if you have a teenager having that kind of pain.
So what are the treatments out there?
So there are medical treatments and there's surgical treatment as well. So there is the idea of giving like hormones, either estrogen and progesterone combined or progesterone only, to try to suppress the endometriotic pain, the endometriosis pain. And of course, if someone's trying to get pregnant, they can't be on those kind of meds. There's also really strong medications, something called Lupron, which is a brand name, but it's a gonadotropin releasing hormone agonist, a GnRH agonist. There's also the antagonist, more recent oral meds that can be given. There's a lot of different medications that can be given, but they all preclude getting pregnant. They don't let people get pregnant. So women who have fertility issues and have infertility or subfertility because of endometriosis, they do better when they have surgery, actually, which is more invasive, obviously, but laparoscopic day surgery with little incisions, day surgery, to treat the endometriosis surgically gives some time frame before that disease potentially comes back to have a better success rate in terms of getting pregnant. So surgery can be very useful for pain and or fertility.
What else do we need to know about endometriosis leading to infertility?
Yeah, so endometriosis can affect fertility and cause infertility in different ways. It's an inflammatory chronic condition that really can impact. The hypotheses are like the events that are supposed to happen in vivo in the body for pregnancy to happen. Maybe eggs don't get picked up as often by the fallopian tube because of the inflammatory process, or anatomic distortion, or both. Fertilization rates are potentially lower, embryo development rates are lower in vivo in the body potentially, and implantation rates of the embryo into the uterus. But the most accurate implantation rate data comes from embryo transfer, from IVF and an embryo being placed, because we have an objective embryo transfer. We know the embryo has developed and is being placed in the uterus. That's the best data you get. And there are some studies showing lower implantation rates with embryo transfer for endometriosis patients versus not, and some studies say it makes no difference at all. More recent studies with genetic testing of embryos karyotypically normal says no difference. So it's kind of a controversial, conflicting data kind of thing.
There you go, Dr.